Hi guys, my name is Niyati and welcome to this Chegg Tutor video. I mostly tutor biology and medicine related topics here on Chegg, and today we're going to learn a bit about congestive heart failure. So let's get started. What is heart failure? Heart failure is basically a clinical syndrome or like a group of different symptoms that can happen when a person's heart is unable to provide enough perfusion in order to meet the body's metabolic demands for substrates and oxygen. So basically, the heart can't pump out enough blood to keep up with the body's demands, is essentially what heart failure is. And depending on what the causes are, and depending on what part of the heart is affected, there's different types of heart failure. So let's look at the different types of heart failure and what causes it. So classification and pathology of heart failure. So basically what's happening is your heart pumps blood to the left side of the heart, the left ventricle pumps blood to the aorta, into the systemic circulation, which is all the different organs in the body, and your right ventricle pumps blood into the pulmonary circulation, which is basically into the lungs, where the blood undergoes oxygenation in the alveolar capillaries and is returned to the left side of the heart, where it's then pumped to the rest of the body. So your left side and your right side are kind of divided that way functionally, even though the entire system is connected on a whole. Your left side is a higher pressure system and your right side is a lower pressure system. So essentially what happens is that the heart is unable to pump enough blood to meet the body's requirements. And the reason for this it can be two reasons. One is that the heart is unable to pump hard enough, which is systolic failure. And the second one is that there's not enough blood coming into the heart in the first place, which is diastolic failure. So the example that I like to give is kind of like a bottle filled with water. So if you have a bottle filled with water and you squeeze it really hard, that is going to be your normal heart function where the water is going to come out. In case of systolic heart failure, what happens is it's kind of like squeezing the bottle, but not squeezing it hard enough, like only giving it a gentle squeeze. If you ask a person who's not as strong to squeeze it, less water is going to come out. So that's what happens in systolic failure, where the heart muscle is unable to pump hard enough to supply enough cardiac output. Diastolic heart failure is basically where the ventricles are unable to relax and receive blood. So I'm going to change the slide here so it's easier for you to follow. The ventricles in diastolic heart failure are stiff and they're less compliant. And compliance is kind of like the ability to stretch and receive more blood. So it's kind of like, imagine a water balloon, where if you start filling it with water, the water balloon gets bigger so you can fill more water in it. But in case of diastolic failure, the ventricle is just kind of like, it's really stiff. And so it doesn't allow more room for water to come in. So that's why if you don't have enough water in the water bottle in the first place, say you fill it only halfway with water this time, then when you squeeze it, you're only going to have a little bit of water coming out. So that's why in diastolic heart failure, it's not really a problem with how hard you squeeze, because you're still squeezing it as hard as a normal person would. But because there's less water in the first place, that's why you have a reduced amount of water going out, which is a reduced cardiac output. So that's kind of the main difference between systolic and diastolic heart failure. Now, one important difference between them is that in systolic heart failure, you have a reduced ejection fraction, which is a reduced percentage of blood that's coming into the ventricle is pushed out. But in diastolic failure, the ejection fraction is kind of going to remain the same, or we call it a preserved ejection fraction, because the amount of blood coming into the heart is also low. And because of that, the amount of blood that you're pushing out with every beat is also low. So your numerator and your denominator are both decreasing, so which is why your ejection fraction is going to remain the same. So let me just write that down here, just in case. Oh, here, I have it right here. So your ejection fraction is your end diastolic volume minus your end systolic volume divided by your end diastolic volume. So end diastolic volume is effectively the volume at the end of diastole, which is the volume at the end of your ventricular relaxation. After your ventricles have relaxed and filled completely with blood, that's the amount that you have. Your end systolic volume is the amount that remains in the ventricle after the ventricles have contracted. So your stroke volume is basically the amount of blood that the ventricle pushes out every time it contracts. So if you had the say like end diastolic volume at the end of diastole, you push out a certain amount, and that leaves you with your end systolic volume. So the amount that you push out is your stroke volume, which is SV. So SV over end diastolic volume, and if you express that in as a percentage times 100, that gives you the ejection fraction. Normally, your ejection fraction is somewhere between 50 to 55%. So in systolic failure, you have a lower ejection fraction, but in diastolic failure, you can have a preserved ejection fraction. The difference between the musculature of the heart in both cases is that in systolic failure, you have a very thin muscle wall, which is why your heart is unable to pump hard enough. And because of that, there's a lot of room in the ventricles. So your ventricles are dilated. In diastolic heart failure, your muscles are taking up a lot of space in the ventricle. There's a thicker musculature, and so there's less space for the blood to come in because the muscles are what's taking up all the space in the ventricle. So you have a thicker musculature and reduced filling in case of diastolic heart failure. So now, either of these two, systolic heart failure or diastolic, can occur on both sides. You can have systolic heart failure on the left side or the right side, or you can have diastolic failure on the left side or the right side, or you can have both. And the difference in symptoms and signs depends on what side of the heart this is happening on, which I'm going to talk about in a later video. But just so that you know, there's some differences that can occur depending on whether the heart failure is left-sided or right-sided. So we'll talk about that in a later video. So let's look at some of the causes of heart failure. So I've kind of listed the causes of heart failure separately for systolic and diastolic, but a lot of them overlap. That's just something I want to clarify right at the beginning. So what causes heart failure? So anything that weakens the heart's ability to pump is going to potentially cause heart failure. So coronary artery disease or ischemic heart disease is one of the major causes. And what happens in this is that the blood supply to the heart muscle itself through the coronary arteries is reduced. This is most of the time because of atherosclerosis, which is narrowing of the arteries because of the fatty plaque. And because of that, there's less blood, less oxygen to the heart muscle itself. And because of that, the heart muscle becomes, the heart cells, which are the cardiomyocytes, they die off. And because of that, the heart muscle itself becomes weak. So that's one of the main causes of heart failure, which is ischemic heart disease or ischemic cardiomyopathy. Or MI, which is a myocardial infarction, occurs because of that. It's basically sort of like the end stage of your ischemic heart disease going to lead to a heart attack, essentially. Another important cause is long-standing hypertension, which means that if the blood pressure in your blood vessels has been high for a very long time, your heart has to pump very hard to push blood against that pressure to make sure it gets to all the organs. And if the heart has been doing this for a very, very long time, that can cause it to decompensate, what's known as decompensation, which essentially means that the heart can't pump any harder and it just kind of, it gets tired, and which is what essentially causes heart failure. So your heart can't be beat hard enough to supply the demands of the body because it's pumping against too much pressure. Another important cause of heart failure is cardiomyopathy, which is basically cardio meaning heart, myo meaning muscle, and pathy meaning there's a disease. So effectively, there's something wrong with the musculature of the heart itself. So that is an important cause of heart failure as well. Another important cause is valvular heart disease. So for example, if you have mitral stenosis or mitral regurgitation, basically the valves are located in between the atria and ventricles, and in between the ventricles and the great vessels. On the left side you have the aorta, on the right side you have the pulmonary artery. So there's valves in between all the chambers and in between the ventricles and the great vessels. As you can see in this diagram here, you have a mitral valve here on the left side, and you have a tricuspid valve right here on the right side. Over here you have the aortic valve, and over here on the right side you have the pulmonary valve. So whenever there's if the blood is flowing in the wrong direction through one of these valves, as in the case of regurgitation, for example, or in the case of stenosis, where the valve opening is too narrow to allow all the blood through, there's always going to be some blood that's either staying where it's not supposed to stay, or the blood is coming back in the wrong direction. And this is going to cause, can potentially cause heart failure, because the heart is having to pump out that extra blood every time because the blood keeps coming back in the wrong direction. So that's kind of a simple way to explain why valvular heart disease can cause heart failure. For example, also if there's, in case of aortic stenosis, for example, in aortic stenosis, your aortic valve, which is the valve through which your left ventricle pumps blood into the aorta, if that valve is very, very narrow, your left ventricle is going to have to pump against a very high pressure to get all that blood through the tiny aortic valve opening. And if that happens over a long period of time, that could lead to your left ventricles kind of giving up and leading to your left-sided heart failure. And then another cause is arrhythmias, where basically the electrical conductive system of the heart is functioning improperly, and so you have impulses going off at all these different times, and so your atria and your ventricles are not beating in synchrony with each other. They're not kind of orchestrated in their beats. So this kind of leads to a chaotic heartbeat, and because of that, again, the blood is not ejected properly the way it should. So this is another cause of heart failure, which is arrhythmias. And then causes of diastolic heart failure, basically what I mentioned before, where the heart is unable to relax. And the reason this can happen is because of infiltration of different things into the heart muscle, like fibrosis or amyloidosis, which is basically an abnormally folded protein, extracellular protein, that accumulates within the heart muscle. So this causes the heart to not be able to relax properly. And because of that, there's less blood coming into it. So any sort of infiltration like fibrosis or amyloidosis can cause, or maybe even cancers, or hemochromatosis, which is a disease in which there's a lot of iron accumulation in the body. That can also lead to diastolic heart failure because of the iron that's getting deposited within the heart muscle. Like I said, hypertension again can cause diastolic heart failure. And aortic stenosis or valve disease also can cause diastolic heart failure. So these are basically some general causes of heart failure. The main one, like I said, is ischemic heart disease, where there's decreased blood supply to the heart muscle itself. Ischemic heart disease, long-standing hypertension, cardiomyopathy, which is basically pathology with the heart muscle itself. There's something wrong with the muscle itself, not necessarily with the blood supply. And then valvular heart disease, in which your the direction of blood within the heart is either it's going in the wrong direction, as would happen in case of regurgitation, or it's happening against too much of pressure, as would happen in case of stenosis. So I hope that kind of gave you a basic general overview of what heart failure is. And before I end, I would want to kind of go over what it is, what decompensation and compensation means. So I'm gonna kind of write this down for you to help you understand. So, whoops, hang on. Sorry about that. You have, so cardiac output is basically heart rate times stroke volume. Just write that down right here, times stroke volume. So let me just define a couple of these things. So cardiac output is basically the amount of blood that your heart pumps out per minute. Your heart rate is the number of times that your heart beats per minute, and your stroke volume is the amount of volume that your heart beats, that your heart pumps out every time it beats. So your cardiac output is basically your heart rate, how fast your heart is beating, times how much blood your heart is beating out each time it pumps. So in heart failure, as we mentioned before, effectively your cardiac output is lower than the demand. So your body, say, needs a certain amount of blood when you're, say, exercising or going about your daily activities. And your cardiac output is basically what maintains that perfusion, is what maintains your body's supply of blood and oxygen. When this goes down, however, when this goes down, however, your heart is going to try to compensate for it. And the way it's going to do this is it's either going to try to make the heartbeat go faster, so it's going to try to increase heart rate, or it's going to try to increase stroke volume. So your heart is going to try to compensate for this lower cardiac output by either beating faster or beating harder, by trying to squeeze out more blood every time it pumps. What this is going to do is it's going to cause your heart to use up more energy. It's going to cause increased oxygen requirements of the heart and more energy requirements of the heart, because you're going to need more energy to make the heart beat faster, and you're going to need more oxygen and energy to make your heart beat harder. But as we already know, your cardiac output is low. So this works for a while. Your heart is able to increase your heart rate and your stroke volume for a while to compensate for the increased demand and the lower cardiac output, which is happening because of the heart failure. But after a while, your heart can't compensate anymore. What happens is that because of the increased oxygen demand and energy demand for the compensation, that demand isn't met. So your heart it's trying, but it can't compensate anymore. And that's the point where you have decompensated heart failure, where your heart, so it's kind of like a cycle where you have, I'm gonna draw this right here to help you understand it a little better. So you already have heart failure. So your cardiac output is low. So in order to compensate, your heart is going to try to increase your heart rate and increase your stroke volume by trying to beat faster and harder. In order for this to happen, your heart needs increased oxygen supply and increased energy demand. But, however, because of heart failure, your cardiac output is low, and this oxygen demand cannot be necessarily satisfied. So even compensating for it becomes hard. So after a while, the compensation occurs for a while. But then eventually, you're going to have decompensation. And what that means is that your cardiac output is going to be low, but your heart isn't even going to try to do anything about it. And what's going to happen? Your cardiac output is going to become lower and lower. And eventually, that's basically what we're trying to prevent. It's a vicious cycle. So that's what it means by compensation and decompensation. And as I'm going to talk about in further videos, a lot of treatment that we use in heart failure is aimed at trying to stop this vicious circle that keeps happening by using certain medications. So I'm going to talk about that and also some of the signs and symptoms of heart failure depending on the difference in left-sided versus right-sided in my subsequent videos. So I hope this video helped you understand a little bit about heart failure and what it really means. If you have any questions, my link to my Chegg Tutor profile is down below. I hope you enjoyed this video. I hope it didn't confuse anyone, but if you have any questions, feel free to ask me. And thanks for watching and have a wonderful rest of the day. Bye!